So our journey here starts with the advent of COVID-19, which everybody now knows was unexpected and unplanned, and most certainly left a field in the NHS. In spite of my 40 years experience in managing healthcare organisations, I can't remember a single occasion when we'd actually planned for an event of this scale. So it was certainly a one-off that caught us off guard. Next slide, please. When we were talking to our clients, there were a number of new things that they were mentioning to us. First and foremost, which we certainly see an unfolding on national news, is that NHS resources, both within providers and across whole systems, were becoming very stretched very, very quickly. And what that was leading to was increased demand on services like 999 ambulances, NHS 111, and local hospital EDs, which then led to increased use of intensive care units, which then bled across the whole system. And the second point that our clients mentioned to us is they were worried about the risk of infection through in-person appointments, and they were very keen to very quickly understand was there a solution out there which they could adopt, which could help to reduce avoidable face-to-face contacts. And again, we saw unfolding on the news the adverse impact of COVID on healthcare professionals, with increasing numbers becoming sick in their own right, and on occasions ending up very ill indeed within hospital ICUs. Next slide, please. Alongside that, research had already indicated that we had some very positive changes amongst the ways that public engage and want to engage with each other, that we could use 64% of consumers do more than half of their shopping online. 30% of citizens expect to use live chat when contacting organisations. We knew that 40% of companies had already implemented digital transformation to improve communications with service users, and over 75% of NHS hospitals were already using or planning to use some form of online engagement and digital services. Next slide, please. Those changes bled across to very short-term changes in care models as well. So we were noticing, particularly with NHS 111 GP out of hours and GP practices, that they were increasingly first model, where they wanted to engage patients over the phone, supported by video consultations, to help to assess the patient's need and support referrals where needed. As well as that, increasingly clinicians were looking to work in harmony with each other in groups, either to share experiences within their own clinical groups, or to provide support, multi-skilled support to groups of patients, while still avoiding the need for face-to-face contact.